everyone. Good afternoon, everybody. I am Sanya Acharya from Beautiful Spotless Skin. I sure all of you must be keeping good health. Misuse of topical steroid is a widespread phenomena among young people in India, especially women. Viewers, as you know, many people are using cosmetic products, mostly fairness creams, without knowing that products contain steroids and assuming that they will get fairer and glowing skin. But they do not know that inappropriate use of steroids may cause severe side effects. According to study done in 12 Indian cities, found that almost 60% of all patients who had skin problems on their face were using creams containing steroids without any prescription. Side effects of this abuse were seen in the form of growth of facial hair in women, worsening of pimples, and thinning of skin, causing severe sensitivity to sunlight. The practice is associated with significant adverse effects and poor awareness of these effects among the general public. To keep you informed today, we are here to know about aware on topical steroid abuse from experts. So let's connect today with our skin expert, Dr. Shreyehs, live from Mysore. Today, Dr. Shreyehs will speak on India's obsession for fair skin battling TSDF, that is Topical Steroid Dependent Face. Dr. Shreyehs is a renowned certified dermatologist and trichologist working as chief dermatologist at Bhanavi Hospital and Shreyu Skin and Hair Clinic, Mysore. He is also a gold medalist in his field. Dr. Shreyehs MBBS, MD DVL, FRGUHS Trichology, and doing remarkable service in the field of dermatology. Welcome, Doctor.
Thank you. Thank you so much.
So, doctor, my first question to you is that what is the reason behind this steroid menace?
Okay. Now it's a quite an important question. Good question. This steroid menace it's not just a matter of few days or few weeks. It has started since time immemorial. The main reason why this might have come into our population, especially in India or especially in Asian subpopulation, where we have wheatish, skin colored or dark skin colored population in our country. Most of us are in that. It is mainly because that we are a tropical country, that it's a God-given gift for us, that our skin color is brown to dark, to just avoid us from being photosensitive or getting our skin burned or tanned. So it's actually a normal phenomenon or a God-gifted skin color which is there for us. But what is happening nowadays, because of the lack of awareness, because of friends and family and relatives and TV advertisement, ads, Instagram reels, Facebook posts, there's so many things which are there, which are, in fact, I can say that it's brainwashing our population. So why it has happened? Because from time immemorial, we have learned, or it has come into our mind, that fair skin means associated with something, posh lifestyle, or having a good hierarchy, placed in a very good, family, or higher caste, higher creed, and that they have better job opportunities, that they have better career opportunities, and they get better bride or bridegrooms for marriage. So these are all the basic problems why this fairness craze might have started. I have seen many patients of mine who come and say, obviously, doctor, won't I have, basic, liking towards getting fairer skin? So that's what they tell me. So, but they don't know, or they're less likely to know how they are going to suffer in the future for trying to get fairer. So this fairness menace has come from, it has started even from birth. Haven't we seen mothers taking saffron, citron fruits so that their kids are, or the babies are born fair? So it starts even from within the womb itself. So that fairness craze has started from within the womb, and it is infinite. So there's no end for fairness menace in India. And to blame that, obviously we have to blame ourselves, because no one is going to take responsibility of your skin that is spoiled. So that is the main reason for the fairness menace in our country: lack of awareness and listening to others rather than doctors. So instead of going and visiting a dermatologist, so what they do, they get suggestions from friends, they get suggestions from relatives. So someone has given them a cream, They have got better little bit on applying the creams. What do they do? So even you apply. So apply and try first, and then if something happens, then you go to the doctor. So this is the mentality which is there in our population. So that is the main reason for fairness menace and its side effects.
Rightly explained, doctor. So my next question to you is, what are the types of skin color?
Yeah. So now this is very important, but because first we need to know whether we can change our skin color or not. So first, there are two types of skin colors basically, that we call it as constitutive skin color and facultative skin color. Constitutive skin color is a type of skin color which is present since birth. That is, it is genetically determined, and it is not under influence of sunlight or hormone. So this is the basic skin color which is there for anyone, genetic at birth, whatever you have got, that is a constitutive skin color. So there is a something called facultative skin color. That facultative skin color is one which comes after the birth. That is because of chronic environmental exposure, because of chronic sun exposure, because of the hormonal influence. So because of these things, the color keeps changing, and the constitutive skin color will no longer remain as such. So it becomes so-called the facultative skin color. So what can be changed? Probably the facultative skin color can come under the influence of treatment, but the constitutive skin color can never be changed. So if you try to change the constitutive skin color, then you're definitely going to damage your skin. So these are the two types of skin colors. So the main, the stress should not be to change the skin color. The main stress is to have a healthy skin and probably a glowing skin. So we need not worry about the skin color, because haven't we seen many of the beauty models or who have got beauty titles? Have they haven't they got they don't they have dark skin color? Are they not Miss World or Miss Universe who are black or dark or brown? So why do we want to go for a fairer skin, right?
Definitely, doctor. As you said, healthy skin is the most important thing, rather than comparing your skin with others. Doctor, my next question to you is: we are talking about steroids. So, what are basically steroids?
Yes. So now this steroids are a group of drugs which are basically given in a lot of conditions. As such, steroids are not bad if they are prescribed by doctors, if they're used for proper conditions, if they are supervised, if they're logically, legally given or prescribed. So we have, in fact, haven't we seen during COVID that steroids are life-saving medications, right? But when does it harm you? That when you don't get it prescribed from your doctors and you start using by yourself, because you don't know about the steroids, you don't know the classification, we don't know the potency, we don't know how long to use, we don't know how much to use, and we don't know what are the side effects, and what if side effects comes, what to do. So then the problem comes with steroids. So steroids are a group of an anti-inflammatory drugs which are given in many conditions. We being dermatologists or skin specialists, we give steroids in few conditions. It may be inflammatory dermatosis, we give in certain autoimmune disorders, so we give in some eczematous conditions. So these are the conditions which we give. So we decide for the patient what is needed, what is necessary, how long to be given, what to be given, where to be given, at what time to be given, how long it should be put, and when it should be discontinued, what they have to look into when they're using any steroid molecules. It may be oral or it may be topical. So then these steroids can be used. In fact, steroids are not supposed to be given without a doctor's prescription. But what happens, unfortunately, in our country, not just steroid molecules, there are so many drugs which we get over the counter. So you need not give a prescription. You go and ask, give me such medication, the pharmacist will pick up and give it to you. So we have, our bureaucracy or our laws are so weak that people are coming under the influence of over-the-counter drugs. So they think that giving a 200, 300, or 400 rupees for a doctor and wasting that much money for his consultation. Instead, I can go and get it on the over-the-counter drug, isn't it? And also these steroid creams are coming under cheaper amount. So they're going to get it in 20 rupees, 30 rupees, 40 rupees, within 100 rupees for them. So it's easily available. In fact, the steroids are scheduled H drugs, so it shouldn't be given without the over the counter. But in our country, it is not possible. So people are learning from seeing Instagram, social media, basically, or YouTube, and someone is saying, and they're getting it. So this is the reason why it should not be put in the public domain without any the information on steroids. A good information can be given, but the information on whether it should be used or not should never be given on the public platform.
Rightly said, doctor. And as you said, that steroids should be used only with doctor's prescription. Doctor, one common question arises that my skin is dark or brown. My friends, have suggested me some fairness cream. They have got fair. Can I use
Yeah.
it? Can I use the same cream?
Yes. So that's what, it's a big no. No one should guide you other than your doctor or dermatologist, not doctor alone. Why? I'll tell you. Dermatologist should suggest you. You should take their opinion and then only apply any creams. You know what happens with these creams which is available? We have double combination, we have triple combination, we have four combination, we have five cream combinations, which is totally unscientific, irrational, and it is no one is, see, once someone starts applying these creams, who's going to supervise them? Who will supervise them? Is there anyone to supervise them? So they don't know. So they start applying. So someone has said, say my aunt says to me, so I have applied this cream, I got it from medical store, it's easily available. So you go and take from there and you start applying. I started noticing, my skin started getting fair in 2 weeks, in 3 weeks. So that is what, that is the only the picture which she said, not more than that. She doesn't know anything more than. So then what happens? This person starts, the second person starts applying. So then he gets to know something about it. Then he says to someone else. So first thing to be done is, in case you don't know anything about it. So what patients say to me, sir, doctor, I didn't know about it. So if you don't know what is the first thing will you do, you please don't start applying it. So that's the first thing you do. So if you don't know about anything, please don't start it. So take an opinion and then start. So these combination creams has a steroid, has tretinoin, has hydroquinone, has an antifungal, has an antibacterial. It's like nothing works, let something work. Anyway, don't know what is the problem. So any five creams I've added. So if a patient has any one problem, by chance let it work. So that is the science, which is very dangerous. So you're not supposed to use those creams which will get you these short temporary fairness. Okay, so these have a long-term side effect. So what is the topical steroid damage phase or topical steroid dependent phase we are talking about? It is not a temporary problem. It is a semi-permanent or a permanent issue. That means your skin can get damaged permanently forever, and you may not be able to recover from that. Okay, so this steroid combination creams or steroid alone creams. So we have certain drugs. We say mometazone, fluticasone, betamethasone. Okay, so we have so many molecules which are there. So these are all molecules are put into one by the pharma companies or pharmacies or those who want to make profit from it, and they are utilizing our populations, vulnerability. So we are so vulnerable that certain companies are utilizing it and trying to make profit out of it, but sufferers are customers, right? So you should stop using any creams based on recommendation from anyone else other than the dermatologist, because we are seeing that prescriptions given by those doctors other than dermatologists are also having certain creams combinations which are giving certain side effects. And also, more than that, leave about doctors, they might have some knowledge about it other than dermatologists. What about quacks? What about those doctors who are in alternative medicine, so like homeopathy and all those things? So even they have started prescribing, which is the main reason. And also pharmacies, you go to pharmacy, pharmacy guy himself will act like a doctor. He thinks he knows everything about steroids and all its composition, all its side effects, what is the treatment about it, and then starts advising you. So please don't take advice from anyone other than a dermatologist. So please don't start any creams without thing. What there is one notion that acha chalo, it's a cream, no? So I'll apply. If anything happens anyway, I'll stop and I'll wash my face and leave for a few days, it will become normal. So if I give some tablet for someone, will they swallow it? If someone says, take this tablet, you swallow it, nothing will happen. So that, that, but they don't do that. They don't swallow it because they are afraid, what if I swallow, what will happen? I die, something happens. So the same fear should be there when you're applying any creams on your face. So that is the main thing. So don't take advice from anyone.
Right. So, as doctor said, take advice from a dermatologist before applying any cream on your face. Doctor, my next question to you is that what are the combinations of drugs we see in this, fairness cream?
Yes, fairness cream. So like I don't mention the brands. There are a lot of fairness creams. There are, I think in the past few months, I think probably more than 10-15 new drugs might have come with this combination, starting from least potent to super potent. So there are various class of potency of steroids, starting from least potent to super potent. So they have added least potent steroid, super potent steroid, not alone, and in combination. Like I said, in combination with the retinoid, in combination with the hydroquinone, in combination with an antifungal, in combination with an antibacterial, and so many other things also like menthol, and so on, so parabens, and so many things are added into one cream so that they make the profit out of it. So in one tube, if they put many molecules, they are going to get a profit out of it. So that is the main combination. So any combination you see with ONE, mometazone, fluticasone, betnovate, TE. So all those things, please do not apply. Okay. So these are the combinations which are there in the market. We have steroid alone, but combination creams are much more disastrous because they are having so many side effects on the skin, which you will, by the time you recognize, you're already caught in the that problem.
Yes, rightly said, doctor. And doctor, does using steroid creams really, make us fair?
Okay, so now we are coming. So what is the effect of steroids? So this is where we come in land finally. So how does steroid cause fairness? Yes, it causes. Yes, it causes fairness. I agree with that. But but what, at the cost of what? At the cost of what is the question? When the person starts, now today I start applying a cream, say mometazone, I start applying on my face. In 2 weeks, I can see my fairness. Right? In 2 weeks, my skin will become fair. What is the reason? So now uh, these steroid molecules are melanopenic. That means they deplete the pigment which is present in the skin. So once they do this, they have certain other effects also, like it has immunosuppressive effects, it has anti-proliferative effects. So then it has anti-pruritic effects. It also has, it brings about atrophy. So it also brings about facial hair growth because of hormonal like effect. So among all this, one thing that we usually are worried or more attracted towards it's getting lighter. So in 2 weeks it gets lighter. So what happens after that? After 2 weeks you start seeing the side effects. Now there are people who get effects in 7 to 10 days. By 7 to 10 days or by 2 weeks they start getting some side effects. What do they start getting? They start noticing their skin starts becoming reddish. Once they go out, they expose to sun, they start getting irritation, they get redness on their cheeks, on those affected areas. They feel that they're getting some hair growth, they're getting lot of dryness, they're feeling lot of irritation, they are getting some acne and all these things. So fairness is one of the side effects of an steroid cream. It is not one which is desirable. So we don't want fairness with steroid creams. We have so many other options to get, or a tan or any other pigment disorders to reduce. So we don't want to go for fairness creams because fairness creams have got, into 10 number of side effects than they're giving fairness. So fairness creams do bring, or these steroid creams do bring fairness, but that is temporary, but at the cost of your skin, at the cost of your future.
Very well explained, Doctor. Doctor, now we have a viewer's question. Our viewer Ananya is asking, how do we know that our skin is addictive to steroids?
Ha, okay. So now what happens once you start using steroid, you will get addicted. No doubt about it. 100% you will get addicted, or 100% you will get dependent on it. Okay. So what happens now once you start applying steroids? So you get fairer. So what happens? You continue. So you continue, and many people are there who use steroids first, not for just fairness, for acne, for melasma, for pigment, for tanning, for all these things we start using steroids. So it gets better in few weeks. Now then, after starting, problems start arising in 2 weeks to 3 weeks. Now what happens? In a bid to remove that, you start using even more amount of steroids, the same steroids. So initially, in the first 2 to 3 weeks, you might have improvement, but then again, you're going into an other vicious cycle that you're never able to come out of. So you start getting pigmentation. So there is something called rebound phenomenon. That is, once you start using steroids, you have completed 3 to 4 weeks. Now your skin is so much addicted to it. It's not that the skin is addicted. The skin is showing some side effects, but you are getting addicted to it. What is the addiction? Why? Because if I stop the steroids, my face is becoming even more worse. So what do? I start using the same steroids, or I start using some steroids which is even more potent, and try to get it cleared. So now if I stop it, I feel my face is getting darker and getting more acne. So what has happened? You are into addiction. So you are not ready to accept the fact, and you're also not ready to stop the steroid. Until you apply, you're fine. Once you stop it, then you are under the influence of all the side effects. So this is the time that you feel that stopping the steroids is making your face worse, and you're continuing to use it. That is the addiction,
Yes,
and
definitely,
that is the
Doctor.
dependence.
Yes, so steroids can be addictive, as Doctor said.
Yes,
Uh,
yes,
our
that is the reason.
Yes, Doctor. So our next viewer is Faria Bag asking, is it possible to reserve thin skin from steroids?
Sorry, is it possible to get thin skin?
It is possible to reserve thin skin from steroids.
You mean to say reverse? Reverse?
Reserve, reserve,
Reverse?
reserve, reserve, reserve.
Okay, okay, okay. Reserve. Okay, because I didn't get the meaning of that. What they meant to ask. I probably assume that I think it's a reverse. That means that on applying steroids, your skin will get thinner, right? On applying steroids, your skin will get thinner. One of the component, or one of the action of steroid is epidermal atrophy. That means on applying steroid, it is what it does. It avoids, or it disrupts the keratinocyte from rejuvenating, or it brings down the keratinocyte population. It brings down the collagen 1 and 3 population. It prevents the fibroblast from doing its work. So all these actions will make your skin, or you make your epidermis very thin, so thin that the underlying vessels can be seen through your skin, either in the form of erythema, or we put a dermoscope, we can see the dermal blood vessels which is underlying the epidermis. So now that may be permanent, or they may be semi-permanent. It takes a long time if you want to reverse that, depending upon how long you have used this steroid and what potency have you used. If you have used a steroid which is super potent, you'll get the side effects at a very earlier date. Okay, so then you stop it, you get to know about it, you stop it earlier, then good. If you don't, then you will not be able to get back that skin. So we have some, skin rejuvenation procedures or collagen remodeling procedures that might help us, to reverse the epidermal atrophy, but most of the time it is semi-permanent.
Okay. Okay, doctor. So now we have our next weird question. Abhishek asking, sir, what are the side effects of stopping the steroid application?
Yes, yes. So now, most of the side effects are using steroids, but there are side effects on stopping also. Finally, whatever it is because of steroid. Okay. it's because of steroid. Now, what will happen? What side effect will you start? Now, when you start applying steroids, these steroids have vasoconstrictive effect. That means on applying, the blood vessels have endothelium. That means the blood vessels are lined by endothelium. This endothelium will release nitric oxide. So this nitric oxide is a vasodilator. Now, because when you start applying steroids, your blood vessels are getting constricted. That means it's getting smaller. So then you will stop or try to withdraw the steroids. You'll try to stop using the steroids. Then what happens? In the first 2 weeks after stopping, you will have rebound phenomenon. That means your skin starts getting just going out of your home will start giving you that redness, itching, burning, heat-like sensation. Now, this happens because now the blood vessels which are there in your skin are constricted. Now you withdraw. That means you stop using steroids. Now these stores are there within the blood vessels, nitric oxide. They will get released at once. So once they start releasing, those blood vessels which were constricted, they have become more than the size of the previously what they were. So they were previously one size, now they have become double the size, because now that is a permanent vasodilation. So because of which your face starts flushing, looking red, looking erythematous. Someone can easily make out like as if someone has put rose on their cheeks. So that is one of the side effects. And also they have immunosuppressive effects. That means our skin has a lot of bacteria, it has a lot of parasites residing with us. What do they do because of immunosuppressive effect? You start getting tinea. That means you start getting fungal infection on your face. That is one of the side effects on using long-term steroids. And also what happens, then you get acne form eruptions. They all like pustules, because of the follicular epithelium, that is the follicular opening will have issues, and that will start giving you pustular acne or papular acne, basically inflammatory acne. So this is one more side effect. Then you have atrophy. So atrophy on long-term use, because your skin has become thin, you can see blood vessels, that is called, we call it as telangiectasia. They can cause scarring. That means because of long-term steroid use, epidermis atrophies, there be something called pseudostellate scars. So this is one of the side effects. Then hairs start appearing because of the local hormonal like effect. You start getting hirsutism, especially females. So these are all. Then you get perioral dermatitis. That means around your mouth and around your eyelids, there is a lot of itching, lot of redness, lot of scaling. So these are all the issues which starts coming on your face. So apart from that, you may have these issues away from your face also. You're applied for the face, but you're having issues away from the face also. So that can also happen. That is distant from the place where you have applied the steroids, you can have some these effects also. So these are the things which is very difficult to manage unless and until uh, you show to a doctor.
Very well explained, doctor. So, doctor have told us the side effects of using while stopping the steroids on your skin. Doctor, the next question is from a viewer, Muskan Sharma, asking, sir, in acne treatment also, does steroids have any role?
No, 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 no. Now the thing is, why do someone think about it now? Steroids have a role in acne, probably steroids, as I told, is an anti-inflammatory, right? So why should we go for steroids? There are certain other group of drugs which are anti-inflammatory. So we don't want to go for steroids because steroids has an anti-inflammatory action, but also comes with many other actions, like I said, immunosuppressive effects, epidermal atrophy, then hirsutism, that is hair growth. So all these issues. So steroids doesn't have a role in acne. So steroids induce new acne. You stop. Haven't we seen many people? We have seen many people who are on oral steroids or topical steroids for some other issue. Some people have autoimmune disorders. They have chronic disorders that they start taking oral steroids, because of which they start getting back acne. They have truncal acne. They start getting acne on their face. So in fact, using steroids will cause more acne. So they will cause inflammatory acne also. They might cause pustules also. So they will have some infestations. We call it as demodesicosis, because there's a parasite which will flourish more under the effect of steroids because of the immunosuppressive effect. Then what happens? You start using steroids for acne. That initially your acne, you might feel that it has reduced, but later on it starts increasing. You will get one more infection along with it. That you get a free fungal infection for free.
Okay,
So
so it
yes.
is like harmful for the skin if we use
Definitely,
steroids.
definitely, definitely. Because acne itself is gonna cause damage to your skin. You will have pigmentation, you will have scarring, and this steroid will in fact aggravate those things because steroid is gonna cause thinning of your skin. So your acne is going to scar your skin. You will have those scars like box scars, like rolling scars. So you will have many scars on your face, which even will become worse or thinner. So you should not use. There is no role of steroids for acne.
Okay. So as doctor said, no role of steroids on acne prone skin. Doctor, our next question is from our viewer Mahima Tyagi asking, does topical steroids also penetrate inside skin?
Yes. Now that is a very good question. In fact, now you see the skin of the face and the skin on other parts of the body are totally different, right? The skin of the face and the skin in the intertriginous regions. For example, inner thighs, okay, and those axilla, that is underarms, in the cubital fossa, where all the two skin oppose each other. They're supposed to be sensitive. Like face skin is more sensitive and it has a thinner layer of epidermis, or overall the thickness of the skin is comparatively less than other parts of the body. And also the face has more of sebaceous glands, that is oil secreting glands, sweat glands on the face. So all the things will make your skin more vulnerable, and it will help the drugs to penetrate deeper. And even if you apply a small amount, most of it will get into your skin. So even by applying a steroid of short contact or a steroid of least potent might cause side effects if you're not under the supervision of your dermatologist. So the skin of the face is definitely sensitive. So what on the face is more sensitive? Now in the whole skin, the sides of the nose, the chin, the cheeks, the upper eyelid, and around the mouth, these are the most sensitive areas of your face, right? And we have also seen that certain people have applied steroids for fungal infection. So we have seen the striae, that the stretch marks, they start appearing on your skin. So this is one more side effect of using steroids. So they can make your skin even thinner. That is why the striae is mainly because of wrong cross-linking of the collagen, which will create intradermal tears in your skin. So that will give you that striae, that red or white striae.
Okay, very well answered, doctor. So there are more questions from our viewers. Varsha Singh is asking, sir, some anti-aging creams also have whitening effects. Do they have steroids?
Yes. Now, the very important. That is why that when you take any ingredients. Now, in my clinic or in my hospital, probably I have so many boxes which the patient themselves have got, saying that I have got from Instagram. No, I see in that there is only a label with some decoration, but no contents. Okay, what is written? Whitening. What do they claim? 10 days. 10 दिन. 10 दिन में आ जाएगा. In 10 days to 7 to 10 days, you are white full. So I say, if you want to get fair, go paint your face. That means your constitutive skin color, that and facultative skin color, just I told in the beginning of my talk, that these two types of skin color, if someone says you will get fairer than your constitutive skin color, then that is danger. So don't agree for that. Don't get attracted to those things. Now someone asked that question, how do I know that? I told you already. So some of our treatments also can change your facultative skin color. Someone comes, sir, I have a tan. We do have a detanning therapy. Someone has a pigmentation. Someone has melasma. Someone has, post-inflammatory hyperpigmentation because of acne, because of eczema, because of so many things. We can treat that. We can get them into their normal skin what they were before, but we cannot get lighter than that, right? So So even we have with proper treatment that the skin can get lighter. That means that is a facultative skin color which can get lighter. Now, how do you know? You have to see the ingredients. So first you have to see what is there on the top of your skin creams which you are using. Most of the whitening creams don't have the contents, right? There are contents which are there, like I already told. You can read mometasone, you can read betamethasone, you can read beclomethasone, you can read clobetazone, you can read halobutazole. These are all the steroid molecules. That is fine. That is their own thing. But there are so many other things also which doesn't give. So just they give one box which is packed with some cream. You keep applying and you start getting the problem. So please read the contents first. If there are no contents, do not purchase it.
Right. And as you said, doctor, read the contents and, consult your dermatologist.
Yes, and
So
read the
next,
content. If you don't understand what it is, consult your dermatologist.
yes, doctor. So next question is from a viewer, Akshat Tripathi, asking how can steroid abuse be prevented?
Okay, so how can steroid abuse or misuse be prevented? First, don't start using it. Right? First, don't
Right.
start using it. If you start using it, you will abuse, you will misuse, you will reuse and do everything. Right? So how to do in case, like probably I can take this to one more question, that if I have already caught in this problem, what should I do? Now I have used it, I've abused it, I've misused it left and right. I've used since 3 years, 4 years, 5 years. Now is the time also to leave it. So you just because you're using it since past 5 6 years doesn't mean you have to continue to use it. Okay, because I have seen many patients that who are using topical steroids have come with bilateral subcapsular cataract. Bilateral subcapsular cataract is one of the side effects of steroid. Why? They have started using steroid. Initially, their skin was good. They have started using steroids. Their skin have got more thinner. Their blood vessels are getting exposed, and the amount of drug which is being absorbed is even more. Like as you start using this steroid over a period of time, the same amount of drug which you're using and the same the strength, more the absorption. So as and when you start using for longer time, you are under more serious side effect of the steroid. Okay, so if you want to stop the thing abuse, first stop using it. Now if you stop using it, you are under side effects. I know there are some withdrawal phenomenon and rebound phenomenon. So for that, please consult your dermatologist immediately.
Yes, so as doctor said, stop using steroids. Doctor, next question from our viewer Harshit Sable is, what does steroids do to a 16-year-old?
Okay, now steroid does the same effect on a human skin, be it 16-year-old, be it 70-year-old. Only the difference may be you are younger, okay, and probably you're under the influence of hormone, or even a 70-year-old skin. The 70-year-old skin, they have a thin skin, they have an atrophic skin, so they might be under earlier side effect. They might get more earlier side effects. Only thing is 16-year-old, the skin is good, and you want to start using the steroids and start spoiling it, you'll get spoiled after a little bit of a later date. Okay, you'll start getting to know the side effects by probably 1 month, 1.5 months, 4 to 6 weeks. That is all the difference. But you will have the same effects of whatever I have mentioned, be it 16 years old or be it 60 years old. Okay, the same side effects are there. There's no difference.
Yes, so as doctor said, there are same side effects for all the people using steroids. Doctor, next question is from a viewer Vaishali Thakur asking, some cream says they have glutathione. It is advisable?
So sorry. It is advisable.
Yes.
Some creams say it is advisable, right? Don't we see in many tablets that there is a slip inside the tablets, inside the package, what all the warnings, what all the advices? So does it give you liberty to use it however you want? So we have so many drugs which says the side effect, the how it works, what are the pharmacokinetics, what are the pharmacodynamics, what are the side effects, what are the dosage. We have an information slip in each of the tablet, right? So can we take it then? So there are many things that it says dermatologically tested, advised, safe to skin. Please don't believe all that. Okay, so only when you start using it you will get to know the problems. Okay, so all that advice and all, by a non-dermatologist or by a doctor. Without that, nothing is going to work. So it is put generally on many creams like that. It is advisable, it is dermatologically tested, that's all. It doesn't give any, 100% proof that it is safe to use.
Right, rightly said, doctor. Doctor, so how do we achieve a fair skin then? Any medical treatments are available for that?
Yes, again, yes, obviously all of us want it to be fair, because we have seen our friends having fair, and he says that he got a good girl or he got a good boy. And we have seen this fairness in matrimonial websites. You have a drop box of one fairness itself. So they mention that I want a fair bride, we want a fair bridegroom. So now, instead of fairness, why don't we concentrate on if you have acne, say, first get it cured. If you have melasma, first take that treatment. If you have seborrheic dermatitis, first go and take treatment for that. And if your skin is good but you're getting tan, then why don't you get a treatment for photomelanosis? And then why don't you concentrate on glow? Why don't you concentrate on glow from within? So why don't you practice a good lifestyle? Okay, have a good lifestyle. If you have any habits like smoking, alcohol, why don't we stop it? So why don't we have nutritious food? Glow is should be from within, not from outside. No, we have so many things to get glow from outside. We have lot of procedures. We have glow procedures. We have lasers. We have we have a lot of medifacials. We have treatment to get your skin glowing but not fairer. Okay, so this fairness is that it's not you getting fairer. It is that you were not practicing a skincare routine. So because of the environmental exposure, obviously your skin is the outermost organ, right? It is the first thing to come under the influence of the environment. So because of the environmental issues, you might have got tanned, you might have got freckles, you might have got lentigens, you might have got DPN, you might have lot of neck pigmentation, you might have skin tags. So get it treated one by one. Your skin will be the best than anyone. So if someone has a fair skin and they have all the issues, like they have acne, they have melasma, they have pigmentation, does it look good? No. So without anything, you have a clear skin. And one more thing, that people are expecting to have a Korean glass skin. People are expecting to have a Korean glass skin. This is India, not Korea. So we are Indians. So our skin is made for our tropical, the belt. We stay close to the equator. So our skin cannot get like that. So there are some natural flaws in our skin. That means you see, we get some tiny bumps here and there. Okay, you touch it, it's a little bit rough. We have open pores. This is because of our belt where we are staying. What you should have is a skin which is healthy, free from diseases. Okay, your skin will automatically glow. So that is more than sufficient, not having a fair skin. So we have treatments, we have lot of treatments, we have safe treatments which will give you a glowing skin, a healthy skin. Please go for that. Stop the fairness creams.
Rightly said, doctor, and you have answered all the questions very nicely. Any takeaway message for all our viewers watching this live?
Yeah. So my biggest takeaway is that if anyone is having any fairness creams or they have ordered online, please cancel it. Okay, claim your money back. And if you're having your fairness creams, any dabba inside your cupboard, throw it into dustbin and go to your doctor. Take a consultation from him. Ask him what you want. Okay, ask us what you want. What do you want? What do you want on your skin? You want a good glow. You want some clarity on your skin. You want to have a healthy skin. You want to feel good on your skin. Please go and ask that. So the doctor will give you suitable suggestion based on your skin type. Okay, so don't go for shortcuts. Shortcuts are most dangerous. They will damage your skin forever. I have seen people who are very good. I asked them to show their photo. When they have come with topical steroid damage, I asked them, please show your previous photo. They were very good, better than my skin. Then why did you start applying? So that is craze for fairness, or overconfidence or something like that, that their skin has become worse than ever. Okay, so they're worse than ever. Most of them, they cannot lift their face and show to the doctor. You want
Yes.
that to happen? No. No. So how much will you spend after your face gets damaged? You're spending you're spending 30, 40, 60 rupees on a fairness cream, and then to correct it, you're paying thousands of rupees. To correct it, you're paying thousands of rupees, because the 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 way or the time to recover is long, minimum an year, minimum 1 year. If you're using even worse creams, even longer times, more than that. Okay, so, and also please don't get disappointed. This I've seen that many people have gone into depression, attempted suicide, and all that. Please don't do that. Okay, it's repairable, it is okay, manageable, it is treatable. So go to your doctor, take immediate medical attention. Okay, that is what I want to tell you.
As doctor said, go to a doctor and take advices. Uh, thank you so much, Dr. Shreyas, for your valuable time. It has been very informative session for our viewers. It is great to hear you. We really look forward for many such sessions for our viewers in coming time. Thank you, viewers, for all
Thank
of
you so much.
participation. Thank you, doctor. Thank you, viewers, for your participation for today's session, and stay connected to our beautiful Spotless Skin page. Thank you.